This is Martha, who lives in Malawi. She is a 64-year-old retired teacher. She tested HIV positive 12 years ago. She also suffers from hypertension and diabetes. She has a large pile of health records from many years of attending different clinics for her various conditions. For HIV, Martha gets her treatment in Tisungani Clinic, which was opened by Dignitas almost 12 years ago. Today, 1 in 10 Malawians are like Martha living with HIV. For more than a decade, Dignitas International has been working in partnership with the Ministry of Health to tackle the AIDS epidemic in Malawi. And for people like Martha with several interrelated conditions, we are now expanding to treat these as well. We launched our efforts in 2004 at the height of the AIDS epidemic. Our Tisungane clinic has dramatically improved access to life-saving HIV treatment and care. To date, more than 25,000 patients have started antiretroviral therapy.
Today, Tisungane is a center of excellence. It offers an array of patient-centered services and handles complex cases for the southeastern zone of Malawi.
And beyond Tisungane Clinic, we have helped to bring HIV services to 174 health centers so that millions can access HIV care in their communities.
Together we have transformed HIV from a deadly disease into a chronic condition where, if properly managed, people can live long and healthy lives.
However, there are challenges looming ahead.
Sugar?
According to the WHO, the rapidly rising rates of non-communicable disease are threatening to create a new epidemic. Non-communicable diseases like diabetes, hypertension, and cervical cancer are projected to become the most common causes of death in sub-Saharan Africa by 2030.
Today, 1 out of every 3 of adults in Malawi suffers from hypertension. Unfortunately, the vast majority are not on treatment or worse, are completely unaware of their condition.
Yet where there is a challenge, there is also an opportunity. By leveraging the investments made in scaling up HIV services, Dignitas is piloting, evaluating, and adapting an innovative model to integrate HIV and NCD screening and treatment at our Tisungane clinic.
During our initial pilot phase, funded by Grant Challenges Canada, we have integrated hypertension, diabetes, and cervical cancer screening and treatment into existing HIV services.
For Martha, who also has hypertension and diabetes, this helps a great deal. Diabetes in particular has a high incidence among HIV-positive patients. She is on multiple treatments and in the past went to separate clinics, so there was no unified approach to her care. Her HIV treatment worked well, and after 12 years, she is still on the first-line antiretroviral therapy. But she found controlling her sugar and blood pressure much harder. Today, attending a single clinic with coordinated treatment and counseling, she has been able to improve this a great deal, and she has fewer clinic visits.
Sometimes there's a big queue there, so waited for a long time. But when I come to this, I don't take a long time. It's better to go to one clinic.
Martha's story is itself told as one of a series of case study videos we have developed to train health workers.
We have developed guidelines for integrated care, updated training tools, trained healthcare workers, and adapted the medical record system for improving monitoring and evaluation.
Along with the Malawi Ministry of Health, partners in health, and other collaborators, we are also engaging in research and policy initiatives at the national level through Malawi's Knowledge Translation Platform.
we have developed a systematic policy brief to improve the screening and treatment of hypertension in people infected with HIV.
As our pilot phase concludes, we are incorporating our lessons learned to deepen our services and expand our geographic reach so that more people can benefit from improved healthcare in their communities. Responding to evolving patient needs with practical solutions is at the heart of what we do at Dignitas.
Together, we'll continue innovating, learning, and growing to tackle barriers to healthcare so that more people can regain their health and reclaim their dignity. We invite you to join us.